We also at Samaritan as well see people who suffer from depression, and there's various forms of depression. Some people, will show certain signs, while others are more depressed and the symptoms become more significant. For instance, some of the symptoms we look for are difficulty sleeping, frequent crying spells, inability to concentrate, difficulty sometimes getting along with others. And these are all symptoms that we look for when an individual comes in for dealing with depression. And we really work to help them understand what's underneath their depression, what's driving it. It may be a life disappointment, something that didn't work out well. It may be the loss of a loved one or a failed marriage. All these factors, life circumstances, can contribute to one feeling depressed. Some people have what's called situational depression, which is more short-term, and it's related to a direct event that's occurred in their lives. Other people suffer from what's called chronic depression, where maybe they've suffered from years from depression. I find that a lot of times we will refer individuals out to see a psychiatrist or primary care physician to get medication, but I also inform the patients that medication will help the symptoms, but it won't deal with the underlying causes of the depression. So as a therapist, it's my job to get to what's underneath the depressive symptoms. So I will talk to them about past experiences or current life circumstances that may be contributing factors, and then we look at how we can handle those more appropriately. Again, I use what's called solution-focused therapy, which helps them not to just dwell on the past, but really focus on what needs to be done today to overcome some of these hurdles that they need to clear. Another thing we try to do is to get them plugged back into life. I find that a lot of times people that suffer from depression, they have a tendency to isolate. And God created us to be in relationship. So when we begin to isolate, Satan is actually able to work a lot more on our heart. And I find that people typically become more and more depressed. And so what we try to do is to challenge them with certain tasks that I'll give them to participate in life activities that get them more plugged into life, whether it be at church or joining a softball team, fill in the blank, whatever is comfortable with them, and it challenges them to get out and socialize more. I find that, again, we were created to be in relationship, and when those relationships are taken away, all of us are prone to depression. We desperately need each other to function in a high way, and so getting them plugged back into life can be so very, very beneficial.